Hey everybody, I'm Dr. Richard Stevenson and I'm the Director of Education at Stevenson Dental Solutions. I'm also an Emeritus Professor of Clinical Dentistry, UCLA. Our teaching center in San Dimas is set up for hands-on courses. Probably 75 to 80% of our time is with hands-on. Today we're going to cover the Kilgore 700 Series number 5 all ceramic crown. And I want to introduce our new Burr kit. This is called the Universal Restorative Burr kit, and it is 30 years in the making. And I put together all of the little special diamonds and carbides that I would want to use to perform virtually every restorative procedure that we can. I'm utilizing operative diamonds in lieu of carbides for the most case, except for caries removal and finishing and polishing. I'm going to be using carbides. So today I'm going to show you a little bit about how this Burr kit works, and here's a key for what burrs to use in what situations. But specifically today we're going to utilize the all ceramic crown for posterior series, which is right here. If you're interested in this burr block, all my YouTube followers or even just viewers can get 20% off the burr block by adding the code YouTube20 in our shopping cart at Stevenson Dental Solutions store. So I hope you can take advantage of that. Now, tooth number 5 is a short tooth on this Kilgore Typodont. And if we look at the occlusion that's being made, you can see that there's a fairly large gap in the distal area. It's not in occlusion. So that's going to require some careful measuring. And for this purpose, I'm going to use the RGS-3 to get an idea of how much space there is. Look at that, already over 1 millimeter of space in this area. But we're going to do this from the beginning of the contour and cut down into the tooth. And I'm going to utilize a putty that we also have available in these little putty packs from our store, and lay this on the tooth and then make a little fiduciary mark so we can see which side is forward. I like to then trim this so that it's a little bit more user-friendly to place it in the mouth. If this were on a real patient, of course, you'd want to trim this down so it would be as petite as possible and could enter into the mouth without any obstructions. So I do like to carve this back, take off some of the bulk, and for this I'm utilizing a sharp scalpel blade. You can see that it's really well adapted to the teeth, so we'll find this to be very useful. The key point here is that we cannot use the existing occlusal scheme as a reference point because it's already out of occlusion. With the K as 0, and I could have used the 837-012, but I decided to make this really simple today and only utilize 4 burrs. So we're going to use this burr, which is 1 millimeter in diameter, to start our reduction. There's an RGS-3 showing us that we have 1 millimeter already, and we know that we're looking for 1.5 to 2 millimeters for all ceramic materials. Now, if it's zirconia, we're going to be much happier with less than 2 millimeters, probably closer to 1.5, maybe a little less than 1.5. I don't think I would purposely go to as little as 1 millimeter because I don't believe that the science shows that that's appropriate, even for zirconia, when we have an opportunity to get a little bit more thickness. For all ceramic material that is not zirconia, for example, lithium disilicate, or perhaps even a bilayered zirconia crown, we definitely want to have more clearance than 1 millimeter. So 1.5 to 2 millimeters would be appropriate, very much the same as a PFM. PFMs require 2 millimeters of clearance, and the all ceramic bilayered materials also require approximately the same amount, perhaps just a little bit less. And then if we're using lithium disilicate, it performs so much better and has so much more longevity if we can give it a little bit more reduction. Now, I understand that you've been told that you can make lithium disilicate very thin and it performs well. That's true if it's bonded and bonded to enamel. So if you were doing a full mouth rehabilitation where you want to increase the vertical dimension and utilize lithium disilicate as like an onlay that would be bonded to the surface of the enamel, 1 millimeter would be sufficient. I think you're making it very difficult for the technician to develop a lot of beautiful anatomy if you do that, but it is possible. So generally speaking, I like to use 1.5. We're going to continue with exactly the same KS0 burr, 100 micron grit burr, and we're going to create a fillet margin. This is not a shoulder, this is not a chamfer, it's not a deep chamfer, it is a fillet. And a fillet margin has essentially the shape of this burr creates the fillet margin. It's a wide radius internal line angle with a 90-degree, slightly actually more than 90-degree downward declination with respect to the reference of the horizon. A chamfer is going to decline downward about 60 degrees. This burr is going to be used to create a little declination angle of probably closer to 15 degrees. So it's just slightly obtuse. The name that we like to use, those of us who have started using this term, is ceramic obtuse fillet. Now we're going to utilize the 𝐤𝐸𝐬𝐿 to get between the teeth. And this is probably something that I think the more of a early learner, perhaps a beginner to intermediate, would want to use this technique to break contact. Those of you who are further down the path could certainly just use the same burr we've been using, the KS0, to push through the interproximal. Avoiding the adjacent tooth is a skill set that takes many years of hard practice to obtain. It is not something that you can obtain readily after even 5 years. You have to really use high magnification, an excellent handpiece, the best burrs, and a lot of practice. Until you reach that level, I think it's probably better to utilize a burr like this. Now on the facial, you notice that there's a secondary plane, and we want to take the 𝐤𝐸𝐬𝐿 and line it up with the adjacent tooth and tip the burr so that you parallel that adjacent tooth area in order to get a much better contour. The same thing applies in the lingual. Now it's time to start refining with the KS0F, which is a 30 micron grit diamond, and is going to be utilized to reduce the additional 0.5 millimeter that we had not reduced initially, and the burr will be used to also smooth the surface. And so you can see what we're doing here is taking off about half of the diameter of the burr. The diameter of the burr is really helpful. It's 1 millimeter, so you can utilize this to check how much you're reducing as you go and not have to go back to the putty all the time. Now you can see that we're definitely increasing the occlusal clearance, but we have areas where we have under reduction, and you can see that this is the RGS3, which is just barely fitting, so that's only 1 millimeter in some areas. And this is just not reduced enough. Look at that, 0 reduction almost at that tip. So the secondary plane needs to be increased. We need to get a little more reduction across the occlusal as well. And this is why I love using putty guides whenever possible. And I do this clinically all the time. It's virtually a routine in the practice when we're treating patients so that we make sure we reduce enough. Under reduction is by far the most systematic error created by dentists. Under reduction. So we need to be better. And what I'm doing here is just showing you that I don't really want to touch the functional cusp bevel, but I do want to reduce this area on the occlusal by steepening the KS0F. And that's what we're doing now. One straight plane across the lingual that B plane, and on the C plane, 2 planes. So we're utilizing now the RGS 4, which is 1.5, and it shows us that we're just still not enough. It's quite interesting that you could use depth cuts and use your reduction guides like closing the typodont together and measuring, and you will swear that you're done when in fact when you use the putty you can see that you have still a ways to go. This is the RGS 4 1.5 millimeter diameter, and it's terrific for measuring the amount of reduction you have. You can see that I found it necessary to use the 𝐥𝐤𝐤𝐿 again on the facial to get a little bit more clearance. Now we're looking at the RGS 3, which is 1 millimeter, and we're just still not enough. And so I can mark it if I want and continue to reduce this area with a little bit more inclination. Don't try to reduce this tooth all in one plane. If you do, you're over reducing unnecessarily. There we go, that's at least 1 millimeter. And 1.5 would be even better. Give us a little bit more room for layering, or perhaps for just more thickness of the E.max to provide a little bit more blocking out of the tooth underneath, if that were the case, or just a little bit more of a translucent zone. Both those things could be nice with a little bit more reduction. Primary plane, secondary plane, and that's the functional cusp bevel, also known as the A plane. And the other 2 planes are the B plane and C plane on the occlusal. So there's a primary plane and secondary plane on the facial as well. C plane, and there's your B plane. There's your A plane, which is also the functional cusp bevel. So you look at 3 planes on the occlusal, 2 planes on the facial, 2 planes on the lingual. And you see some little undercuts here. And if you draw a line all the way around the junction between the margin, the finish line, and the axial wall, you're going to find that in some areas the pencil line does not show at all. And there you go, you can see on that mesiolingual it's pretty seriously undercut, internal undercut, by the way, not external. And so I can mark it or just remember it, and then we're going to use the burr not at the whole length, but just at the top at first. Just work on that upper area. Don't drop the burr all the way down, and then sometimes you'll find that that alone is enough to remove the undercut. And now that I've got the undercut removed, I can hold the burr parallel to the wall and deepen the margin if I need to. We use a so-called brush stroke. We're not using this like a milling machine, but we're taking little small movements, carefully executed to avoid creating over-reduction. We're also going to lower the finish line clinically to be slightly subgingival, perhaps 0.5 millimeter in most cases, but also could be equigingival in some cases. But for the typodont exam situations you might find yourself in, you want to keep the finish line equigingival up to 0.5 above the tissue. You don't want to have it 1 millimeter above the tissue, nor do you want to have it subgingival. But in this case, we're shooting for equigingival. And you know, things are looking okay, but there's still some tight areas and some undercuts that need to be managed. We look at the bulk of the restoration from the putty, and it looks pretty good. And we're just now looking at perhaps just a little fine-tuning at that secondary plane on the lingual, always looking back at the adjacent teeth to get a guide. And we look for draw, look for taper issues, and we can see that there's a little bit of a exaggerated junction between this primary and secondary plane on the lingual, so that can be smoothed out. We had a little tight area here on the mesial distal that need to be smoothed just a little bit. Going back and checking, make sure that we're meeting all the criteria. And then the 7102, one of the most wonderful burrs ever developed in dentistry. I use this for composites. I use it for preparations to smooth edges. It's just remarkable. It's a great carbide. It can be used in slow speed, high speed, and it bevels the sharp edges. And as we know with ceramic, particularly if it's milled, we must try to take away any of these sharp transitional areas, because the milling machine is going to over mill sharp areas. Even with a 5-axis milling machine, you're going to get some over milling. So oftentimes I will prep differently for a milled restoration versus a pressed ceramic restoration. And there we go, 1.5 just fits. And on the distal it was quite a bit more because we started with 1 millimeter of clearance already. Putty's so helpful. So, you know, we're getting to the point where I think that this preparation is about completed, and we can assess it in different orientations. We can make sure that it follows the contour of the adjacent tooth, gradually increasing as you go up towards the occlusal on the facial side. We want things to be smooth, clean, no issues with undercuts, no sharp edges, 𝐥𝐤𝐤𝐵 close to it. And then we know that we've accomplished a decent result. I really do like looking at all of my preparations from this sagittal view, from the side view. It is so helpful to see if we have enough space for the ceramic. So guys, thanks for watching. Once again, the code is YouTube20 in our store to get the Universal Restorative Burr Block at 20% off. It's a good deal. They will sell out really fast, so check it out. And if you ever are in town in Los Angeles, please stop by my teaching center. Would love to meet you. And let's remember that excellence is a journey, not a destination.